Good afternoon. Thank you for joining the yoga therapy webinar. All of us at Mayo Clinic Health System appreciate you taking time to join us today. I'm Kathy Lydahl. I'm a community engagement specialist at Mayo Clinic Health System. I'm so excited about today's program, but before we get started, I wanted to walk through a couple of the Zoom features we will be using during today's presentation. And I just wanted to note too that the webinar is being recorded for future viewing. We will be using the Q&A section at the bottom of your screen. The little green arrow is pointing to the button that you can click on. We encourage you to ask questions anytime throughout the presentation. So you simply click on the Q&A, type in your question, and as an attendee, you can click the thumbs up by a question another attendee has put on there, and it will upvote and go to the top of the list. And also today, we will be using our polling. So the polls will be conducted anonymously. The polling question will appear on your screen as you see it. And you click on your answer, and then you hit the save button. And so it's that easy. After each poll, the results will be shared. So let's get started. Michelle Hoffman, a certified yoga therapist at Mayo Clinic Health System, is joining us today to speak on yoga therapy, how yoga therapy can relieve pain, manage stress, and so much more. Michelle has been teaching therapeutic yoga for over 20 years and is certified by the International Association of Yoga Therapists. Michelle has been employed as a yoga therapist in the Integrative Medicine and Health Department at Mayo Clinic Health System in Red Wing for 11 years. She specializes in working with people of all ages who are living with a variety of health challenges. Michelle offers individual yoga therapy sessions to help people recover from injuries and surgeries, manage chronic conditions, reduce or eliminate symptoms, and increase overall health and vitality. Michelle also teaches small group therapeutic yoga classes such as yoga for type 2 diabetes and yoga for low back pain. She also works as a yoga therapist in the Mayo Clinic Hospice program with yoga therapy and healing touch therapy. So Michelle, we will have you take it away.
Thank you, Kathy. I'm very happy to be here today. I'd like to start out by asking a few questions to the audience to get a sense of who is joining us for this webinar today. So my first poll question is, do you have experience with yoga? So if you could answer the question. And then hit save. So it looks like 43% have had some experience, 31% no, and 27% some. Well, the good news is anyone can do yoga. My teacher used to say that if you can breathe, you can do yoga. So everyone starts where they are, and the practice of yoga should be adapted to the needs of the individual. The second poll question is, do you have a chronic health condition or pain that affects the quality of your life? So if you choose yes or no or somewhat, and then hit save. So we have 36% yes and 25% no and 39% somewhat. Well, yoga therapy can be very helpful for chronic health conditions and managing chronic pain. And our third and final poll question is, do you know the difference between yoga and yoga therapy? So we have 2% yes, 90% no, and 9% somewhat. Okay, well, although all yoga is potentially healing, most yoga in the United States is taught in fitness-based classes emphasizing the body. So the yoga means union or link, and classical yoga emphasizes wholeness and integration, linking mind, body, and breath. And when people think of yoga, most people think of the physical poses or stretching, when in fact, yoga has many tools to offer for healing body, mind, and spirit. The next slide, please. Oh, I guess, no, sorry, go back, sorry, I guess. Could you go back, thanks. So the tools of yoga include the physical poses, which we call asana, the breathing practices, which we call pranayama, meditation practices, the use of mantra, sound or chanting, the use of hand gestures, which we call mudra, ritual, the practice of self-inquiry, studying ancient yoga texts, such as the Yoga Sutras of Patanjali, and a disciplined lifestyle, or cultivating healthy habits. And next slide, please. So yoga therapy is the specific application of yoga tools to address physical, mental, emotional, and spiritual needs of the individual, either in a one-on-one session or a small group class. Yoga therapists are specialists and have in-depth training in anatomy, physiology, psychology, and assessment tools. We learn about chronic health conditions and what will help and what will harm. We work with our clients to address their specific needs and goals and design a yoga therapy practice that is tailored for that individual. A general yoga class can ease your everyday aches and pains and release stress. Yoga therapy goes further because a yoga therapist works with you to address your specific needs and goals while respecting any limitations you may be experiencing. So a person may come to me for a private yoga therapy session with the main goal of reducing or eliminating low back pain. And I would use yoga poses and breathing practices to release tight muscles and strengthen weak muscles and bring balance to the body to help reduce or eliminate their back pain. However, this person is much more than their back pain. This person may have COPD and suffer from shortness of breath and anxiety. So I would develop a relationship with the client and work with them to design a yoga therapy practice which addresses all their needs, mind, body, and spirit. My goal would be to teach them a practice that would reduce or eliminate their low back pain, ease their shortness of breath, and reduce their anxiety, thereby increasing the overall well-being, their overall quality of life and well-being. Next slide, please. So the goals of yoga therapy in general are to eliminate, reduce, or manage symptoms that cause suffering, improve function, help to prevent the occurrence or reoccurrence of underlying causes of illness, assist the client in moving toward improved health and well-being, and to help clients change their relationship to an identification with their condition. So now I would like to lead you through a yoga therapy practice. And since this is a webinar and I cannot see or speak to you to learn your specific concerns, we will do a gentle practice with the intention of loving kindness and compassion for ourselves. The practice will include a guided meditation and visualization to help ease discomfort in mind and body. The practice will also include breath-focused movement to release tension and discomfort in the body. Please do not move into pain. Not every pose or movement is for everyone. So if a movement or pose is uncomfortable for you, modify it or sit quietly and focus on your breath until we move on to the next pose or movement. So I would like to invite you to sit comfortably in your chair. Close your eyes if that's comfortable for you, or have a soft downward gaze. And take a moment to check in with yourself. Bringing your attention to your physical body with kindness and curiosity. Observing any sensations you may be feeling in your body in this moment without judgment. Observing the quality of your breath. Just noticing if it's short or long, shallow or deep, smooth or a little bit ragged. And you can notice if the exhale and the inhale are about the same length, or if one's a little longer. Notice any places of tension or discomfort. Where you feel open and where you feel closed. So just noticing how you're feeling physically with kindness. Bringing your awareness to the quality of your mind. Notice if your mind is active with thought, or if it feels a little dull and sleepy. Or do you feel alert and clear? Observing the quality of your energy. Notice if it's light or heavy or balanced. And notice any emotions that may be present in this moment. And acknowledge them with kindness. So begin to take conscious control of your breath. Slowly taking in the air and ever so slowly letting it out. Feel the expansion of your body as you breathe in, and your lungs fill with rich oxygenated air. And notice how you soften into your chair as you breathe out. And softens the hard earth. Allow the gentle flow of the breath to loosen and soften any hard or tense places, washing away any pain or discomfort with the out breath. Take a few more deep, full, relaxing breaths, slowly taking in the air and ever so slowly letting it out. Letting the exhale be a little longer than the inhale. Releasing tension in body and mind with the out breath. And then we're going to place our hands on our chest, if that's comfortable for you. Sitting up tall in your chair. You can keep your eyes closed or open them and just listen to my instructions. So take a moment to once again notice how you feel as you sit here in this chair. Sit bones connecting to the chair, your feet solidly on the ground, and your hands are on your chest. And if you can't do the arm movement in this next pose, just move your head and focus on the breath. So we're going to inhale, open the right arm, opening to the right. So twisting the body gently right, relax the shoulder down. And then as you exhale, you're going to bring your hand lovingly to your chest and tuck your chin. Then we're going to inhale slowly, open to the left. Look back at your left hand. And then exhale, bring your hand to your heart, tuck your chin. Let's do that one more time. We're going to inhale, open to the right. And then exhale, bring the hand back to the chest, tuck the chin. And then inhale, open to the left. And exhale back. And then we're going to inhale, open both arms, shoulders down and back, look up, stay there, exhale, drop the shoulders down. Inhale, expand your chest. And then exhale, bring your hands lovingly to your chest, tuck your chin. We're going to do that 2 more times. We're going to open on the inhale, shoulders down and back, stay there, exhale, relax the shoulders down, stay there, inhale. Feel the stretch in the chest and exhale, bring your hands back to your heart, tuck your chin. So one more time, opening, inhale. Stay there, exhale, relax the shoulders down, breathing in. And exhale, bring your hands to your heart, tuck your chin. Then we're gonna bring your head back to center. And then we're gonna stretch the side of the neck. So take an inhale. And then exhale, tip your right ear towards your right shoulder, depress that left shoulder down, come back to center. And then we're going to exhale, tip the left ear towards the left shoulder, depress the right shoulder down, back to center. So we're going to exhale, float that right ear towards the right, back to center. And then exhale, float that left ear towards the left and back to center. So let's do one more time. Exhale, float that ear right. And inhale back to center. And then exhale, float the ear left. And back to center. And then you can place your hands on your knees. You can move your head a bit. Take a few breaths. Notice how you feel with curiosity and kindness. So the next pose we're going to do it in a chair. It could be done on the hands and knees, but for simplicity's sake today, we're going to just do it in the chair. So you can put your hands on your knees, plant your feet a comfortable distance apart, sit up tall on the sit bones. This one's called cat-cow, and it's very helpful for releasing tension all the way down the spine, especially in the neck and the upper back. So my hands are on my knees, sitting up tall. So we're going to inhale, lift the chest. Looking up, shoulders down and back. And then as you exhale, you can tuck your chin round your upper back and pull your navel in towards your spine. This is exhale. And then we're going to inhale, lift the chest. Look up, feel the stretch in the front of the body. And then pulling the navel in, exhale, round like a cat, tuck your chin. Let's do that 2 more times. We're going to inhale, lift the chest, looking up. And then exhale, round like a cat, tuck your chin. One more time, inhale. And exhale. And then inhale, come back to a neutral spine. Once again, notice how you feel. Body, mind, and breath. And then let's put our hands once again on the knees. We're going to bend forward a little further. So if this is too much for your back, you can do a couple more of those cat-cows, because you always want to avoid moving into pain. So we're going to inhale, lift the chest. And then as you exhale, slowly bend forward. Pull your belly in, slide your hands lovingly down your legs towards your feet. Stay there and inhale. And pull your belly in as you exhale, sink a little bit further into the pose. We're going to inhale, slide our hands lovingly up the knees, lift the chest. Let's do that a couple more times. We go forward on the exhale. So take an inhale and pull your belly in. Exhale, slide your hands down towards your feet as far as you can comfortably go. Stay there, inhale. And pull your belly in as you exhale. And coming up. One more time. So let's do one more repetition. Breathing in. See if you can feel a stretch in your back as you pull your belly in and bend forward and breathe out. Relax your neck. Let's take a few breaths here. Pulling your belly in on the exhale to stretch your back. And inhale, expand the belly. And slowly sliding the hands up. And then we're going to do a seated twist. So once again, sitting tall on the sit bones, plant your feet. You're going to take your left hand and put it on the outside of the right leg and the right hand just on the side of the chair. You want to relax your shoulders down. Try not to hike your shoulder up. So we're going to twist to the right as we exhale. So take an inhale. And then pulling your belly in, breathe out. Exhale, twist belly, rib cage, shoulders, and your head, looking over your right shoulder. Close your eyes if it's comfortable and focus on the breath. Feeling the expansion of your body on the inhale. Pull your belly in as you exhale, twist a little bit more from the belly to the right. Breathing in, expand the chest and the belly. And as you exhale, twisting a little bit more to the right. Notice where you feel this in your body. And as you twist the shoulders right, you can gently turn your head to the left. Relax your shoulders down, take a few more breaths, feeling a stronger stretch on the right side of the neck. Washing away the tension with the out breath. And then we're going to unwind and come back to center. Notice how you feel. And then we're going to do the other side. And sometimes it's easier to twist to one side than the other, and that's okay. You never want to force anything or move into pain. So we're going to take the right hand, put it on the outside of the left leg, left hand on the side of the chair, relax both shoulders down, sit up tall, take an inhale, and then pull your belly in as you exhale, twist to the left, belly, rib cage, shoulders, and your head. Stay there and inhale. And then as you pull your belly in, exhale, twist from the belly gently. Close your eyes if it's comfortable and focus on the breath. Releasing tension with the out breath. Inhale, the belly expands. And gently pull it in on the exhale. As you gently twist the shoulders left, we're going to turn the head slowly right. Take a few breaths there, feeling a more stretch on the left side of the neck. And unwind. And roll your shoulders a bit. And reverse. Move your head. Once again, notice how you feel. Body, mind, and breath. And then let's bend forward just to release the back. Typically, when you do a twist, you want to do some kind of a gentle forward bend. So once again, we're going to place our hands on our knees. Inhale, lift the chest and pull your belly in on the exhale. Take a breath here. And pull your belly in to stretch your back. Lifting the chest. We can add some arms if you want, and you can continue to slide the hands up and down if that works better for you. We're going to exhale, bend forward. Take an inhale. And sink into the pose on the exhale. And if you can bring your arms out to the side, lift the chest, reach up, and then lower the arms. So let's do one more like that, either doing the arms or sliding the hands down. Take an inhale and exhale. Pulling the belly in, feel the stretch in your back, relax your neck, take a breath. And if you can, lift the chest, bring the arms out to the side, reach up, and lower the arms on the exhale. So it takes a little bit of practice to get this linking the breath with the movement. So if you're finding it awkward, that's not unusual. See if you can just focus on a nice long exhale. So let's do one more repetition. Inhale. And you want to bend forward on the exhale. The air goes out. Pulling the belly in to stretch the back, relax the neck, take a breath here. And then bringing the arms up. And then lowering the arms on the exhale. So the next one we're going to do opens the chest. It's good for shoulder. Most people, if they have shoulder pain, you want to get the shoulders down and back. The one thing you don't want to do is bring the shoulders up. That's pretty common for us to have the shoulders up by the ears. So shoulders are down and then squeezing the shoulder blades together. So I'm going to do a couple seated and then I can come to standing. You can do this standing or seated. So we're going to raise the arms halfway up with the palms facing in. Then we're going to make a gentle fist and then squeeze the shoulder blades together. And then we're going to open the hands, stretch the fingers wide. And then making a fist, squeeze. And then we'll open the hands, throw the cares to the wind, and then lowering the arms, fingers wide. So we can add the breath with this. So it's inhale, make a fist, exhale. Breathing in, open the hands, and then exhale, squeeze. And then inhale, throw your cares to the wind. And exhale, lower the arms, fingers wide. So you can remain seated, or if you'd like to try it standing, we can come to standing. Sometimes you have more of a sense of the spine when you're standing, the extension in the spine. So you want to stand with your legs comfortable distance apart, feet parallel, arms are at your side, relax your fingers. Once again, we're going to inhale the arms halfway up, palms facing in. We're going to exhale, squeeze the shoulder blades together. Inhale, open the hands, stretch them wide, and then exhale, squeeze. Let's do that one more time. Inhale, open the hands, and then exhale, squeeze the shoulder blades together. And then inhale, throw your cares to the wind, bend back, and then lower your arms, fingers wide on the exhale. One more time, we're going to inhale, arms halfway up, exhale, make a gentle fist, relax your jaw. Inhale, open the hands, exhale, squeeze. Breathing in, and then exhale, squeeze the shoulder blades. And then inhale, throw your cares to the wind, bend back. And exhale, lower the arms, fingers wide on the exhale. And you can roll your shoulders and reverse, move your head. Notice if you have a little bit more sense of the openness in the chest and if you can breathe a little better. So we're going to do a side bend. In yoga, we bend the spine in all the directions to keep the spine flexible and strong, the muscles strong. So you can either sit in the chair or stand. I'm going to take a wider stance standing. And if you're seated, keep your feet comfortable distance apart with your feet on the floor. So the side bend, you want to keep the shoulders in line with the hips and avoid collapsing forward. You can have your arms at your side. If you're not able to do the arms, you can slide your hands down as you bend to the side or use the arms. We're going to pull the belly in as we move into the side bend to protect the low back. And this is a movement that we're not really used to in our everyday life, so it kind of feels a little bit awkward. But you want to feel the stretch in the side and not in the back. So if you can, we're going to raise the right arm up and inhale, stretch up. And then pulling your belly in, you're going to exhale, bend to the left. Tip that left ear towards the left shoulder, lift the rib cage to the sky. Stay there, inhale. And then exhale, reach as you push down through that right foot. Inhale, come up. And exhale, lower the arm. And then we're going to do the other side, either keeping the arm down or if you can raise the arm up, breathing in. And then exhale, bend to the right. Tip the right ear towards the right shoulder. Stay there, inhale. And exhale, reach. I feel that on my side and not in my back. Lower the arm. So you don't really have to bend too far to the side to feel the stretch. Let's do one more. Breathing in. Exhale, bend to the left. Stay there and inhale, expand the chest. And then exhale, reach as you push down through that right foot. Stay there, inhale. And exhale, reach. Coming up, lower the arm. So notice where you feel this in your body. You want to be mindful of what you're feeling. One more time, inhale. And pull the belly in to protect the back as you exhale, right. Stay there and inhale. And exhale, reach. Take another breath. And exhale. Coming up, lower the arm. Let's do one more repetition. Side bends always make me feel taller and they're a bit energizing on we have a rainy day here in Red Wing. So we're going to inhale the right arm up. Once again, stretch up. And as you pull your belly in, you're going to exhale, bend to the left. Keep the shoulder in line with the hips. Lift that rib cage to the sky. Stay there, inhale. And then exhale, push down through that right foot. Exhale, stretch out through that right hand. Take a couple more breaths. Opening the right side. Don't move into pain. Coming up, lower the arm. One more time, inhale the left arm up. We're going to exhale, pull the belly in and bend to the right. Stay there, inhale. And exhale, reach. Take two more breaths. Pushing down through that left foot. Stretching out through that left hand. And opening that left side. And then coming up, lower the arm. And then we're going to come back to center once again. Observing body, mind, and breath. Notice if you feel a little taller. And this one's good for breathing too, because it stretches out the muscles between the rib cage. So now we're going to stretch our back. You can remain seated and slide your hands down towards your feet as we did before to stretch the back. Or we're going to do a variation of a pose called downward facing dog. You can do this on the floor, but we're going to do it on a chair today. A lot of people can't do it on the floor because it's too much for the wrists or too much pressure on the shoulders. So you can either go to the back of the chair. I'm going to put my hands on the seat of the chair. About shoulder width apart, walk back just a couple of steps, bend your knees, and then pull your belly in and move your hips back. And then you're going to straighten your legs as best you can. And pulling your belly in, exhale, tuck your tailbone. Straightening the legs. And then exhale, moving your hips back, feeling that nice stretch all along the spine. And when I want to come up, I can walk towards my chair, bend my knees generously, use my legs to stand up. And then we're going to come back to the chair. If we were standing. All right, so now I'd like to teach you a practice, one of my favorite practices. It's called the caring breath. And we're going to do this with loving kindness and compassion for ourselves. It uses the healing power of touch, and it's a good one for releasing neck tension. So we're going to start off with one hand on each knee, sitting up tall. Let's do the movement and then we can add the breath. So you're going to bend the right elbow, resting it against your torso, and then bringing that right hand across, bring your hand lovingly to your chest, turn your head left, come back to center. And then you're going to lower your hand to your knee and tuck your chin. Then bending the left elbow, bring it across to the right, turn your head right, and coming back to center and hand to knee, tuck your chin. So you want to keep your elbow braced. You don't want it out here. You want to stabilize the shoulder. So now we'll add the breath. So we inhale, exhale, turn, coming back to center, and then exhale, hand to knee, tuck your chin. Alternating, we exhale to the right, coming back to center, and then exhale, hand to knee, tuck your chin. Let's do one more. We're going to inhale, exhale, turn, bring your hand lovingly to your chest, come back to center, and then exhale, hand to knee, tuck your chin. Breathing in, exhale, turn, back to center, and exhale. Then letting your hands relax in your lap or one on each knee. Close your eyes if it's comfortable or have a soft downward gaze. Continue to focus your attention on your breath. Make it comfortable and easy, no force. And on the next exhale, repeat these words silently to yourself as you breathe out. May I be safe. So as you exhale, repeat the words, may I be safe. And then on the next exhale, repeating the words silently to yourself, may I be healthy. May I be healthy. Take a few breaths, repeating those words as you exhale. And then repeating on the exhale these words, may I be happy. May I be happy. And then repeating on the exhale these words silently to yourself, may I have peace. May I have peace. And then keeping your eyes closed and sitting relaxed in your chair, we're going to move into a guided relaxation. So you can relax your hands in your lap or one on each knee. And feel the support of the surface beneath you. Allow your body to relax now, giving yourself time to integrate the powerful work that we've done in this practice on all the levels of your being, mind, body, and spirit. Relax your belly and feel the gentle rise and fall of your body to the rhythm of each breath. And if your mind wanders off to the future or the past, guide it gently back to this moment where all is well. So letting go a little bit more with each breath. You can visualize washing away the tension in body and mind with the out breath. And you can slowly, mindfully move your awareness through your body, starting with your feet. Relax all your toes. Relax your ankles, shins, and calves. Soften your knees. And relax the powerful muscles of your thighs, letting go of tension in your legs. And bringing your awareness to your hips, softening the glute muscles, letting go of any tension or tightness there. And bringing your awareness to your low back. Take a few breaths with an awareness of your low back. Breathing as if you're breathing into your low back. Releasing tension or discomfort with the out breath. And slowly walk your awareness up your spine, releasing tension all along the spine. Relaxing tension in your upper back. Bringing your awareness to your neck, softening your neck. Letting go of tension in your neck. And relax your shoulders, arms and hands. Relax your belly, that area above your navel, the solar plexus. And relax your chest. Feel the openness there, the spaciousness in your chest, that area around your heart. Relax your throat. And all the muscles of your face. Relax your lips. Releasing tension in your jaw. Soften your eyes, forehead, and temples. So take a couple more deep, full, relaxing breaths. Washing away any remaining tension or discomfort with the out breath. And then you can slowly begin to bring your awareness back into the room in your own time. Wiggling your toes, your fingers, slowly begin to open your eyes. Notice how you feel in your physical body. Notice the quality of your mind, the quality of your breath, and the quality of your energy. So Kathy, it looks like we have a couple of questions. Oh, first of all, I guess I would like to ask people, we're going to do the final poll question. What describes the way you feel now compared to before participating in the practice? So how do you feel after the practice? Do you feel, I'm not sure what that says, yes, no. So do you feel better?
Yeah, I think it's worded wrong though.
Yeah. So just, I guess the word would be, the question would be, do you feel better after the practice? Yes, no, or not sure.
Yeah.
So 11% said not sure and 89% said yes. So, okay, that's great. So I guess we have a couple of questions here from our webinar audience.
Yes, we do.
Hopefully I can
I
answer
see
them.
a couple more come in. So
Okay.
the first one we have is, where do you find a yoga therapist?
All right. So there are other yoga therapists besides myself in Minnesota. I think the best place would be to go to the International Association of Yoga Therapists website. So if you just Google yoga therapy, they will come up, the International Association of Yoga Therapists, and then you can find a certified yoga therapist in your area.
Yes, and Michelle, I do see that Mary Kay shared that link in the Q&A, so people
okay.
can take a look at that and copy and paste that. The next question we have is, where do you, can yoga help with fascia issues? Fascia?
Yeah, fascia. Yeah, that's, so that, I think that it can, yoga, stretches the muscles. I think that, then going to maybe qualified medical massage person, someone who works with deep fascia work, if your muscles are more flexible, then they can go deeper. That's what I found. People have told me that their massage therapists have told them that they were able to work deeper and be more effective after they've done yoga. So I would say yes.
Okay. Our next question is, I could really feel my body letting go of a lot of stress. My shoulders and neck feel so light. I would really like a copy of the recording of this program so I can do this on a daily basis. And she says, thank you. And Julie, we will be sending the link out along with this short survey. So you will have a copy of this since it's being recorded. But Michelle, is there other places that people can find this type of class?
Well, I teach classes here through Mayo Clinic, and I do one-on-ones. If you want to have your own practice, I design a practice for people and then write it down, or we could record it too if people want to record it. So, there's a lot of YouTube videos out there, but I don't think a lot are yoga therapy. I mean, they're more just general. So it's kind of nice to get a practice that's really geared for you. Like, as I talked about the person with the low back pain who could have COPD, anxiety. You could have someone with low back pain come in with type 2 diabetes, and yoga can help manage blood sugar with certain breathing practices, poses. So really it should be individualized as much as you can, because if you're going to take the time, you might as well get the most, for the time you spend, as far as I'm concerned.
And then I have a couple great comments that this has made my shoulders feel much less stressed. So thank you very much. A lot of this was a great presentation. So Michelle, a lot of great comments. So another question, is yoga therapy available in Arizona?
Oh yes, I'm sure there are yoga therapists all over the world.
Yeah, and I don't know if maybe Helen is
she talking about at Mayo Clinic?
Maybe that at Mayo Clinic.
I'm not sure if they have a yoga therapist or not, but I would look on the International Association of Yoga Therapists. I'm not aware that there are very many yoga therapists within the Mayo system yet. I'm hoping that will change.
And Helen, we can get back to you with that answer too. We'll make sure. So okay. To see you or someone here at Mayo, is this something I need to be referred to, or can I make an appointment on my own?
You don't need a referral. You can make an appointment on your own. And my contact information will be at the end on a slide. So I do one-on-ones in person or on Zoom right now, and I do classes on Zoom and a couple of them in person with masks because of COVID-19.
Awesome. And I think we've answered, Linda had asked if you need an MD referral, but you've just answered that. And another great comment, this was a wonderful way to spend my lunch.
Oh, that's nice.
All right, so not seeing any more questions. Most of them are great comments, so thank you, Michelle. Do you have any closing comments that you'd like to share with us?
Well, I just wanted to talk a little bit about the practice today. So several people commented on less neck and shoulder tension. And a lot of us hold a lot of tension in our neck and shoulders. So I did do this purposely. I did put in poses purposely to help you release that tension. But this practice today could be useful for anyone who has stress in their life. Stress can worsen the symptoms of chronic health conditions. So yoga is very beneficial for people with chronic health conditions. This practice could also be helpful for anyone with breathing issues, which would include asthma or COPD, or even people recovering from COVID-19. And this practice could help people with chronic pain, with the breathing practices, the meditation, the visualization, and the gentle movement. So, and I've been practicing therapeutic yoga myself for over 30 years, and it has greatly added to my quality of life. And I believe it's one of the best self-care practices for healthy aging. So thank you for joining me to learn more about yoga therapy and how it can help to improve the quality of your life.
Well, thank you, Michelle, for sharing such great information with us today. You truly relax me. So I hope everybody found the information shared today beneficial and finding yourself feeling a little better. And according to the poll question, the majority of you felt better after the practice. So if you'd like to share this webinar with your friends, family, or colleagues, the link will be sent to you in the next few days, along with a short survey. So we would appreciate if you could take some time to complete that for us, because we enjoy hearing your comments, and also we want to enhance our future events. So like Michelle had mentioned earlier, if you're interested in the yoga classes she offers, you can go to mayoclinichealthsystem.org and click on classes and events and find them there. And if you want to schedule a private session by contacting Michelle directly, her email and phone number are on the screen right now. And I will also be sending that information along with the survey. So if you don't get it down right now, you will be getting that at a later time. So I want to thank each and every one of you for attending the webinar today and taking time for yourself. We hope you enjoyed it, and we look forward to seeing you at future events. So thanks, everybody. Have a great day.